These are the 3 things you must know about safety if you're considering plastic surgery. And the first one is something you might not be expecting. Number 1, anesthesia. Some surgeons talk about the risks of general anesthesia and recommend something called twilight anesthesia or conscious sedation because it's safer. The reality is that this is a myth. Statistically, for healthy patients undergoing surgery like facelift surgery, the risks of an anesthesia complication are about 1 out of 140,000 cases, which is statistically far safer than a single car ride. And for patients having facelift surgery, I'll tell you, it is without a doubt far more reliable, more controlled, and more comfortable to have the procedure done while patients are safely fully asleep. So why do some surgeons talk about general anesthesia as being dangerous in the first place? Well, because sometimes it shifts some of the focus away from what really matters. And that's number 2, the setting. If you're going to be having any type of anesthesia for a surgical procedure where you're partially asleep or fully asleep, it must legally be done in a state-licensed surgical facility. And a state-licensed surgery center means that the building was designed and built for the purpose of anesthesia and for surgery. If someone is doing surgery without general anesthesia, then it gives them a little bit of flexibility where it can be done in a facility that is not state licensed. And that's the difference between a state licensed surgery center and somewhere that's designed to look like an operating room. So how can you tell if something is state licensed? By going to the state's Department of Health website and then checking to confirm whether or not the facility is state licensed. And then finally, third is something called accreditation. Accreditation is where an outside organization comes to inspect a surgery center to make sure that safety, protocols, equipment, staff are all at the highest levels. And the main accreditation groups today are AAAHC and AAAASF. And again, we can confirm accreditation on their websites. So in summary, don't focus just on the anesthesia. Make sure to confirm and verify the setting to make sure the surgery center is licensed and accredited. So if you have any questions, please drop those in the comments below. I'm happy to help navigate this topic safely.